Hello and welcome to the Illinois Diabetes Advocacy Forum. My name is Julie Babbage and I am the Executive Director of the Diabetes Patient Advocacy Coalition. We have been to states from coast to coast and we're really excited to come today to the Midwest for our 6th forum of this state series. Thank you again to all of you who are joining us today. We have an audience here as well as on Facebook Live. That's comprised of people from all parts of the diabetes community. So some of you who registered today indicated that you're type 1, others said you were type 2, others still were parents of children. Some of you have connections through friends and family. So thank you so much, and we're going to get into our agenda here. We will start with an introduction and then go to our legislative panel, which features State Representative Lamont Robinson. We are really excited to have him with us. And in your registration, around 60% of you or so indicated that you have not met with a legislator before. So after today, you can all say that you have. And then next, we'll get into our Advocacy 101 segment. We'll highlight key policy issues that we're working on across the nation, several of which are in Illinois right now. And then last on the agenda, we will wrap it up with next steps, all in just about 90 minutes. Just a quick look at where Illinois stands from a diabetes policy perspective and how the state really measures up. So you'll see here a list of bills that we routinely advocate for. Many of them are popping up in various forms in state houses across the nation. And we get involved in all 50 states as actively as we can. Illinois is doing pretty well, as you can see. A lot of check marks, but it still has some chances to get a few more boxes checked off. And so we're going to do an in-depth review of these issues later on, but we want to give you an overview to open things up today that Illinois has done really well, and it also has an opportunity to continue a lot of this positive momentum. And with that, let's transition to our first legislative panel. I'm going to introduce our moderator while our panelists turn on their cameras so we can have them on screen in just a moment. Based in Columbia, South Carolina, Hunter Limbaugh is the Southeastern Counsel for the Wine Institute. He has been an active litigator for over 20 years and a government relations professional for over 15 years. Hunter is a former South Carolina legislator and chief counsel to the governor. When his daughter was diagnosed with diabetes in 2001, Hunter became an active volunteer for the American Diabetes Association, where he served as chair of the board in 2012. He now serves on the board of directors of DPAC and DLC. Thank you for joining us, Hunter. And I'm going to turn it over to you to introduce our panelist.
All right, great. Thank you very much, Julie. I'm really happy and honored to be able to introduce State Representative Lamont Robinson. Representative Robinson is in his second term, representing the 5th district, which, as I understand it, is an essentially urban district and the Chicago urban district. Notable among his committee assignments is his role as chair of both the cybersecurity and tourism committees. Representative Robinson also sits on the healthcare availability and access and prescription drug affordability committees. He earned his bachelor's degree from Clark Atlanta University and an MBA degree from National Louis University. Representative Robinson owns and operates an insurance practice, I think maybe a couple of them, agencies in the Chicago area, and is also a business professor at Harold Washington College. And also in his spare time, I assume, works as the director of the Kappa Leadership Institute in Chicago. So thank you again very much, Representative Robinson, for being with us, and welcome.
Thank you, Hunter, for that warm introduction. I have family down in South Carolina, and so I will certainly look you up when I'm there. I'm sure it's much warmer than it is here in Illinois. I am currently in Springfield. We start session a little later today, but certainly glad to be here. And Julie, Julie, I appreciate the introduction this morning as well, and thank you for the opportunity.
Well, thank you so much. And if you do come to South Carolina and look me up, make sure you're looking for the guy with the gray hair, not the guy in the picture that they put up of me. Um, but anyway, let me first ask you. Almost everybody has some personal connection to diabetes, and I'm wondering if that's the case with you, and if so, can you just tell us a little bit about what kind of personal connections you might have with it that has led you to be interested in diabetes as a policy issue?
Unfortunately, I certainly have family members on my mother's side that have dealt with diabetes. My mother is healthy, but my grandmother does have a spout with diabetes and has had that challenge for several years and on medication to have it controlled. But the concern is that my mother has always had to share that when she has gone to get insurance. Like most of us, as an insurance agent, Hunter, as you mentioned, I'm in the business of making sure that I protect folks. And it is something that when you try to go out and get life insurance, you have to share that information, or you should share that information. And it drives the cost of insurance up. And so this is something that is certainly near home to me, certainly in my family, also as an insurance professional. And I'm so glad that DPAC has the resources and the wherewithal to fight this, because not only is this an issue in my family, but also my business. When I talk to my clients and they ask me, why is my insurance going up? Because they are diabetic or they have a history of diabetes in their family. And that certainly is a challenge, Hunter.
Well, thank you. Yeah, I mean, it's such a familiar story. And we certainly appreciate everything that you have done and will do. And I wanted to ask specifically about a couple of elements of your work, the Prescription Drug Affordability Committee and Healthcare Availability and Access Committees. Is there anything in particular that you might want to touch on as far as the priorities of those committees that might impact folks with diabetes and
Absolutely.
chronic disease in general? Sorry. Yeah.
Yes, sir. And number one, it is looking at how do something that you might have worked on with your colleagues in the South Carolina legislature. But we know that we have high drug costs, and our folks should not have to go over to Canada to be able to get their drugs. And they also should not have to decide on food on the table or their medication. And you mentioned my district a little earlier. I am fortunate enough to have one of the most diverse districts in the state, high net worth, middle class, low income. But I also have a lot of seniors in my district, and that is the breadth of the work that I've been doing in the General Assembly, because my seniors call me and they also email me and they tell me the issues that they're having around being able to afford their medication and making that decision between food and or paying their rent and or their medication. So we have a huge problem. We know that we have that in the state, and many of my colleagues on both sides, Hunter, understand this challenge, and we're trying to work on how, again, do we lower our cost as it relates to Medicare. Excuse me, as it relates to medications. I apologize.
Right. And I'm going a little off script here, but it's something that I'm kind of interested in. I was talking to a friend of mine, and it just came up just kind of out of the blue, who was having an issue with what's referred to as step therapy. I don't know if you're familiar with that, but it's the procedure where insurance companies require you to take a version of a drug, in this case, a diabetes drug, that may not be the one that your physician has prescribed for you, and try these other cheaper alternatives and fail. before they'll allow you to take the one that your doctor wanted you to take? I was just curious. And if it hadn't gotten on your radar yet, that's obviously a perfectly acceptable answer, but I was just curious if that was something that anybody was talking about in Illinois yet.
You know, I have not heard that. It certainly is not out of the realm of possibilities, knowing what's going on in our healthcare industry. And certainly they're always looking to save costs, and unfortunately saving costs on the backs of folks that unfortunately are have financial challenges. As I mentioned to you a little earlier, certainly the district that I serve has a lot of seniors and a poor community. But if we look at the entire state, I think Julie put up the state in our rural areas is a huge challenge for Black and brown communities as it relates to diabetes, and again, for forwarding their radar, Hunter, and I appreciate you bringing that to my attention this morning.
Yeah, no problem. And again, like I said, that was just kind of a random thing that it's interesting, and like a lot of things, it seems to be, you know, one of those situations where the insurance companies, they think they're saving money, but in the long run, the studies suggest that they end up paying more on account of, you know, folks not doing well on the medication that isn't what the physician prescribed. But anyway, thanks. Yeah, I hope maybe just keep that one in the back of your mind. I wanted to ask you now about sort of the impact of COVID-19 and the disproportionate impact that it's had on certain segments of the population. What is kind of, you know, generally referred to as health inequity or health inequality. My understanding is the Illinois Black Caucus undertook some work to try to address that in some respects with House Bill 158, and was wondering if you might want to just kind of give us a brief description of the problems that you were addressing with that, and what that bill would do to alleviate some of those issues.
Thank you for putting that work on the forefront. I am a member of the Black Caucus, and many folks think that, you know, even though you have to be a descendant or African American to serve on that caucus, Hunter, let me tell you, the bills that we put out all across the state. And so I'm certainly happy to dish these out, just not only for the African American community, but for folks that do not have big lobbying groups. As you know, in your assembly, that everyone has a lobbying group, every corporation has a lobbyist, but poor folks. And so really, Black Caucus is the lobbyist entire state. And this health pillar, fortunately, we have huge health disparities in our state, really across the country. And the Band-Aid was pulled off of this as it relates to COVID-19. When we look at the COVID-19 cases, it was no surprise to many of us that the high numbers of those cases were in the African American community, were in the Latin community, excuse me, as well as the poor rural community. And so really what this bill does is it gets at how are we going to alleviate and make sure that we provide quality healthcare across the entire state, which is, you mentioned the healthcare pillar. But let me punt a moment to another bill, HB 3657, the Health Facilities Review Board. We have a board here in Illinois that really is the stopgate for hospital closures. So this board, if you want to open up a hospital, you want to close a hospital, you can go before this board. Hunter, I had a hospital in the center of my district that been around for 100 years, that unfortunately was on the closing block. Corporation called Trinity. They're a billion-dollar corporation, 92 hospitals across the United States. Wanted to deploy African Americans overwhelmingly, and as a safety net, it's the only hospital that folks could go to that could not afford to pay. And I learned through this process, Hunter, as you get in two things, is that close and not with a lot of closures, and make sure that we're not going to have it. I am still perplexed that any hospital would want to close in the midst of this pandemic, the greatest pandemic that we've ever seen in our lifetime, Hunter. And so that bill really gets at strengthening the Health Facilities Review Board, giving them the power and the teeth to be able to do the research and have the power to really get at, is this hospital closing because of financial reasons, or is this hospital closing because they feel as though they cannot turn a profit in a minority community district. And so there are a lot of bills that we're trying to get at, get past, that really get to making sure that we provide quality health care across the state for Black and brown folks, poor folks that do not have high-paid lobbyists, Hunter. So thank you for allowing me that opportunity to speak on that today, because it's a pressing issue here in Illinois, and I'm sure down in South Carolina as well.
No, good. I'm glad that, Julie.
Yeah, hey Hunter, sorry, I was just going to ask Representative Robinson, I think you're going in and out just a little bit. The connection, I know in the Capitol can be tough. Would you mind to try turning off your video for a moment, just so we can make sure that we're catching the words that you're saying?
Sure.
Okay, perfect. That might give us just a little bit more clarity. But do you mind to repeat the point you were just making? Because I think we lost it a little bit there at the end.
Sure. Thank you, Julie. Again, the Black Caucus really represents poor Black and brown folks across the entire state. And really that health pillar that you mentioned really gets at providing quality health care across the entire state of Illinois. But I punted to HB 3657, which gets at the Health Facilities Review Board. This board is the board where hospitals can go if they want to open or close. Unfortunately, I had a hospital on the closing block, so to speak, called Mercy Hospital, Onia, Michigan. Trinity is a billion-dollar corporation with 92 hospitals across the state. Not for sure, Hunter, they have any hospitals down in South Carolina, but the hospital serves overwhelmingly the African-American community, and I'm still shocked that any hospital would close in the midst of a pandemic. The reason behind this is the hospital said that they couldn't make any money. Because safety nets are hospitals where folks go to if they can't go to any place else, many times Medicaid recipients. And so this particular Health Facilities Review Board really gets at hospital closures and makes sure that hospitals are not coming in front of the board because they cannot turn a profit. Which is another issue that I'm working on with my colleagues across the aisle, and that is a task force to look at our safety nets up in the municipalities up in Chicago, but also the critical access hospitals down in the rural parts of the state. We know we have an issue around funding these hospitals. And so that's the next step that I'm working on, is how do folks go to where they don't have any place else to turn to. And so that is something that I'm working on, again, with Life as an opportunity to have.
Okay. We are still having some difficulty hearing you, unfortunately. I'm going to ask one more question, a final question, as our time is, I think, about up for this segment anyway. And I hope you can hear me, and I hope we'll be able to hear your answer. If not, then I expect Julie's just going to move on. But what I'd like to know from your perspective is what makes a good advocate in your view? What can folks from DPAC do to most effectively engage with legislators? How can we help you help us with the issues that are important to people with diabetes? What's the best way to do that?
Hunter, I hope that you can hear me a little bit better now. I am, as I mentioned, in the Capitol, and I am the chair of data and cybersecurity. And so I will be working on making sure that we have a better internet access here at the Capitol. But to your question, it is really, we need to know as legislators, and you being a former legislator, you know the importance of folks telling us their stories. And so if you have family members, or you have a spouse with diabetes, or you're diabetic, we need to know, we need to hear that story from you about yourself, your loved ones, and how difficult it is, how challenging it is that you're having with diabetes. Because believe it or not, and Hunter, you can back me up, we don't really know everything. And so we really rely on our constituents to be able to share this information for us. And so I would tell you to go to openstates.com. I think that that's a national site where you can put in your address, your zip code, and find out who your legislators are, and reach out to them and let them know, or shoot them an email and let them know what your challenges are with diabetes, and what we could be doing better to make sure that we focus more on this big issue. That is how you can be an advocate, and also come down to, when it's safe, come down to your capitals across the state and let them know that the challenges, again, that you face with diabetes, we need to hear from you, and that's how you can be an advocate.
Okay, great. I did have one other question that we may not have gotten clearly when you were talking before, but did you mention something about a task force that you serve on, out of which your hospital work arose?
That's correct. I am working with my colleagues across the aisle. I'm a Democrat, to make sure that we come together on trying to provide quality healthcare across our state. In my area, I have what's called safety nets. safety net hospitals overwhelmingly take Medicaid recipients. They take folks, whether they can pay or not. And in the rural parts of the state, they're called critical access hospitals. And so I'm working with my Republican counterparts to figure out a way to make sure that we don't have any more hospital closures, that again, that we are providing quality healthcare across the state, and that these hospitals are successful and they have the resources they need to be successful. And so we're looking at studying our again, safety nets and critical access hospitals across the state to determine what could we be doing better in the state of Illinois to provide quality healthcare. And so I'm very happy that I have my Republican counterparts that are working with me on this issue, because we know it's a pressing issue across the entire state.
Is there a name of this task force, or is it an ad hoc thing that y'all put together, or is it a more formal
Sure.
group?
It is ad hoc right now. I would love to come back and maybe bring some of my colleagues on the other side of the aisle to talk about the task force. But we're putting that together right now because, again, we understand that the Band-Aid is off and COVID has removed that Band-Aid, really showing us our inadequacies as it relates to healthcare in the state of Illinois.
Okay, thank you for that. Unless Julie tells me otherwise or has other questions from folks who've been watching, I'll give her a second to. But
that's perfect. Thank you so much, Representative Robinson. We really appreciate it, and we know how busy you are. We know you've got to run over to be in session, but we so appreciate you rolling through those technical difficulties and for making it work today. Is really, really great to hear from you on two of our biggest priorities, which clearly are also two of your biggest priorities, affordability and access. So thank you so much for that. And thank you for the encouragement to everyone here to get involved. We had someone write in and say that they feel like their member just doesn't listen or isn't assisting sometimes with diabetes legislation that should get filed, but there are champions like you in the legislature who are very much willing to work with your constituents and even across the state, it sounds like, to make sure that the correct action is taken. So we want to recognize you for that and really say thank you.
Julie, thank you very much. And to, I'm going to say that constituent that sent that note in, certainly if your legislator is not doing what you would like them to do, certainly find someone else, on social media or in the paper, find a legislator that that's doing the right thing. Even though I serve 100,000 folks in the 5th district, I really serve the entire state. And so I have folks that reach out to me, not in Chicago, but in Cairo and other areas. And so certainly if your legislator is not doing what you expect them to do, I would say find someone else. We need to, again, hear from you and really make sure that we're trying to fight this issue as it relates to diabetes across the country. And so I appreciate, Julie, you and all of the hard work that you guys are doing at DPAC. And Hunter, thank you for allowing me this opportunity to spend with you this morning. It's always good to talk to a colleague that has been through this grueling process in the General Assembly here, whether that be in South Carolina or Illinois. So it was a great morning for me, and I thank you for the opportunity.
Thank you.
Let me add my thanks real quick too. Yeah, I greatly enjoyed talking with you, and please look me up if you're ever in Columbia. I'll do the same if I'm ever in Chicago or Springfield. And thanks so much for your time.
Thank you.
Perfect. Thank you so much. And we know you've got to run. I know also Representative Robinson was really humbled too about his work on hospitals, but to make sure that hospitals, especially in underserved areas, are keeping their doors open during a pandemic of all times is such important work. We know you have really led the way on that. And I know that it cut out right as you were talking about that the first time. I think most of our audience members caught that, but I just wanted to make sure that that wasn't lost on our folks because it is just such important work and we applaud you for that.
Thank you so very much, Julie, again.
Thanks. All right, we will keep moving forward. I was also going to follow up too on one of the things that our panel mentioned was step therapy, which is a really important issue also that we work on. And it actually passed in Chicago or in Illinois, sorry, a few years back. And that was before Rep. Robinson was even in the legislature. So it makes sense that he wouldn't have known about any existing efforts because Illinois fortunately has already passed that important legislation. So thank you for the conversation. Thank you to Hunter, our moderator. And this panel gives us some insight into the way that the legislature thinks. But now we're going to transition into sort of the political aspects of the State House. And we're going to start with a look here. Governor Pritzker is a Democrat who was elected in 2018. And you can see that the House and the Senate are also controlled by Democrats. There are 118 state representatives re-elected every 2 years. The most famous of which, fun fact, was Abraham Lincoln, who actually started his political career as an Illinois state rep. And as far as the Senate goes, that's actually where Barack Obama got his start in politics. So a lot of famous folks coming out of the Illinois State House, and really, really glad to see that. The Senate is comprised of 59 members. Senators are actually, their terms are staggered in Illinois. So it's 4-4-2 or 2-4-4, it basically to match up with each decade and the census numbers for redistricting. And if you don't know who your member is, you see the link here. Representative Robinson also mentioned a resource there as well. I think he said .com, it's .org. Just want to make sure if anybody's using that one that they've got that address correct. And the legislative session, as we mentioned, is currently underway in Springfield, Illinois. It's a busy time right now, and it wraps up at the end of this month. So an especially big moment for lots of members trying to move important legislation. The Democrats are in control, as this slide shows, but that does not mean that they are always agreeing on everything. So there's lots to try to sort out and many opportunities also for bipartisanship. Illinois is a highly populous state, so it is tied for the highest number of representatives in the House and Congress. So we're going to transition now to that slide, and that means the state has a lot of influence, and certainly with two high-profile senators, that is true as well. You have Senator Durbin on the slide and Senator Tammy Duckworth. Senator Durbin is especially powerful, having served as the Democratic whip for a number of years. And that is true now, particularly as Democrats hold a slim majority in the Senate. And if you're not sure who your representative is, again, you can use the link at the bottom of the page. Thank you so much for attending. Here is a to-do list with next steps. You see sign up on the website. You see our social media again. We'd love for you to spread the word, to recruit people, to be involved. More advocates, again, more voices is more powerful. George just said 5 emails is a groundswell. I worked in congressional offices. I know that's true. I know that's especially true for state legislatures. So we hope that you guys are leaving today feeling empowered, feeling a little like you know more about the process and how to be involved. I know that's something that a lot of our champions have asked about, and we have a really strong network in Illinois. So we're glad to get to come here, glad to be here. Thank you again so much. We hope you have an excellent rest of your day and rest of your week, and we'll see you soon. Thank you.